hope you're all doing well. My name is Diana. I'm a hematology-oncology pharmacist. I'm a professor at UMKC, and I practice at a cancer center on the Kansas side, Advent Health Shawnee Mission Cancer Center. COVID-19. This has been one of the emergencies where pharmacists, we can be heavily involved. So I would come in the morning and you would see doing temperature checks, and then we end up wearing masks after checking our temperatures, and we have to put our names on and a mask on after we make sure that we don't have a fever of 100.4 or above. Just part of the safety for our patients. So why am I telling you all this? Well, we played a big role in actually changing our policies and our protocol in order to keep our patients safe during these emergencies. And this is just one of them, having to wear the mask. Now, for instance, I'm taking this off and I will be able to talk to you all as I'm walking outside of the cancer center. So this is the end of my shift today. Basically, there's some types of emergencies that we get involved in as pharmacists, and this time of the year, COVID-19 was one of them. So we had to anticipate, are we going to have any shortages of medications? Are we going to need to order more PPE? There's a higher risk for our patient population, as when we treat with chemotherapy, we usually will decrease their immune system. So we had to think about, are my patients going to be at risk? So we tried to see if we can change anything in their treatments, like extend their treatments, look at studies and supportive evidence to see if that's possible. We tried moving their labs and their other schedules to bring them as little as possible. We played a big role in policy making in order to help our patients prevent side effects. And that's just part of what we did for prevention of infection during COVID-19 and ensuring patients have medications. We respond to emergencies in terms of hypersensitivity reaction. So if patients are allergic to any drugs and they have an allergic reaction during their infusions, what we typically would do, we would attend to the allergic reaction, and we help with recommendations of what drugs do we need to give the patient to help with the reaction. We are trained in performing CPR. If the patient needs it, we recommend what medications need to be done, and once we deal with the reaction, we also make recommendations on how to proceed with subsequent treatment of cancer. This is just like a quick example of someone specialized in cancer working at a cancer center and how things could change.